Today we are discussing about the job of doctor in hair restoration surgery. We will divide it into two parts: job of the doctor in FUT surgery and job of the doctor in FUE surgery. So first we will discuss the important hot topic of job of doctor in FUE surgery. In FUE surgery, the main job of doctor is to assess the patient, how many grafts he is needing in the recipient area. He will be giving consultation, the whole consultation to the patient, and I would insist on this thing more precisely, that doctor is bound to give consultation to the patient. He should not put his patients to the consultants or assistants for consultation. So before surgery the consultation is done by the doctor. Then in operation room, in surgery room, the job of doctor is to extract the grafts from donor area. Whole extraction from donor area is done by doctor, and then preparation of recipient area. Before preparation of the recipient area, he will design the hairline for patient, and at the time of designing the hairline, consultation with the patient is very much needed, and he will let the patient know this is been done with you, and this would be the line of work with you today. This is the job of doctor. And in FUE surgery, the job of assistants is placing of the grafts in recipient area in the slits which has been already produced by doctor. So I think so you must be clear about the job of doctor in FUE surgery. Then FUT surgery, we are talking about FUT surgery. Then job of the doctor in FUT surgery is again consultation, then strip harvesting, closure of the strip harvested area, and then again designing of the hairline, consultation with the patient about designing of the hairline, plans should be discussed with the patient, and then slit producing. I want to say the preparation of recipient area is again done by doctor. And again in FUT surgery, the job of assistants should be like, there are two jobs of assistants. One is graft cutting, and second is placing of the grafts in the slits produced by the doctor. So you should be clear about the job of the doctor in the surgery and before surgery. That's what I wanted to tell you today.